Chi-Chi, it's nice to see you again.
Good to see you, too.
Even though I just saw you this morning. But I'm glad we have a second session together.
So am I.
So if this is the second session that I had with Chi-Chi, I also had the benefit of watching an intake evaluation. So I already had a very good idea about what her history were, what her history was, what her current symptoms were, what were some of the problems. In the first session, we talked about her problem of procrastination. She had a number of goals that she wanted to reach, such as increasing meaningful experiences outside of work, doing some social activism, doing some creative writing, things like that. And that was a fairly straightforward session. But is there something in particular? We really covered the procrastination problem this morning, and we have a plan for dealing with that.
Right.
Is there anything else you want to make sure and talk about?
I did want to talk a little bit more about work, even though that is a similar problem.
So now I'm setting an agenda with Chi-Chi. She's just mentioned that she wants to talk about work. And then I also have a topic to bring up with her. The reason I bring this up is because during the evaluation in the first session, she didn't show a great deal of dysphoria or anxiety or other negative emotion. There was one time, as you hear her say on the tape, during the evaluation, that she really teared up quite a lot, and that was the breakup of a relationship that she had had a number of years ago. So I'm hoping that maybe she'll want to talk about that problem. When emotion is high, then we usually know that that's accompanied by some very important cognitions that we might want to evaluate with the patient. That sounds good.
Okay.
Or no, that sounds terrible. I don't want to talk about it. During the evaluation, there was one time when you got very teary. So I bring up this other problem that we can talk about, and I definitely give her the choice. Say yes if you want to do this. Definitely say no if you don't. You got help at the time, but that there were certain feelings that were so painful at the time that you didn't talk a whole lot about that relationship.
Right.
And I couldn't tell to what degree that's still distressing you, that breakup.
It goes back and forth. If I don't focus on it and don't think about it, then it's fine. And I think as time has gone on and the fact that I'm currently in a good relationship.
When she says, if I don't focus on it, I'm fine, which leads me to think that she perhaps actively avoids thinking about this painful topic. And I'm hypothesizing that maybe she has a certain assumption about experiencing emotion.
I do think so. I don't know why.
Well, that's why I was wondering whether it might be worth talking about that. She seems a little unsure, so I really want to give her some time to think about it. Cognitive therapy is a very collaborative therapy, and I want to make sure that we use the time in a way that's helpful to her. Yeah. Thanks. So why don't we agree not... So here she's tearing up, which makes me think that, yes, this is something important to talk about. Your fears of talking about it.
Okay.
Is it all right if we spend maybe a couple... This is a technique that I'll often use with patients. If they don't want to talk about a certain topic that has high emotion attached to it, that I think probably is ultimately important for them to talk about, we won't talk about that problem itself, but we will talk about their fears about talking about the problem.
Past it.
And what does being stuck there mean?
Stuck in just this feeling of that I haven't been able to move on from my past.
Yeah.
That I haven't forgiven myself.
Oh. I'd like to find out more about what she means by I haven't forgiven myself, but I've promised not to talk about that problem, so I'm going to steer away from that. There are a couple parts to this. If you were to talk about it, you would get very emotional.
Yes.
And you're a little afraid that that emotion would just stick with you. And
yeah, and I also think that when I talk about anything that makes me emotional or teary, it's very hard for me to get past my initial feeling and talk about it in a rational way.
Right.
I find that happens a lot, and that has been an issue in relationships. I find it very difficult to talk to have a really serious conversation with somebody that I'm in a relationship with, even a friendship with.
So now this is a related problem. It's not the breakup of the relationship 15 years ago, but she's bringing up a problem about being able to have difficult conversations with other people, especially when she might become emotional. So I'm in a few moments probably going to give her the choice about whether that's a problem she wants to discuss.
Well, it's hard for a lot of people.
Okay.
It sounds like it's not so much of an issue right now because Mike is away
Right.
for a while.
Right, that kind of.
When he comes back,
Mike is her boyfriend of about 9 years standing, but he's been away for about a year and a half in Iraq, and he will continue to be away for about another 6 months to a year.
And I definitely think that there are things that we do need to talk about that that neither one of us has been able to really do. I mean, I don't know if is it a problem? Somehow we've managed to, I mean, we've been together.
Despite the fact that Chi-Chi is
And
crying easily and is feeling very emotional, it's important to know that she does not have an Axis 1 disorder. She does not have symptoms that reach the level of an anxiety disorder or a depressive disorder. However, I do think she could really benefit from therapy.
comes and there are important
Right.
things to talk to him
right,
about.
right. I think that my fear is that I'm going to get so carried away by, and it's not just a fear, it does happen, that I get so carried away by my emotional reaction
Yeah.
that I don't really end up saying what I want to say.
Yeah.
So her automatic thought is, if I were to broach a sensitive topic with Mike, I'll get so upset that I won't be able to get across the message that I want. And from what she's saying, it sounds like that's probably accurate. So I'm not going to look for the evidence that that's true or not true. I just take it from her that that probably is accurate.
I see a way out of it.
Oh,
I see some things that I think could help.
okay.
So I was very positive here. I don't usually guarantee people in such a strong way. But I did want to interrupt her negative thinking about not being able to solve this problem and have a little bit of a laugh with her, too.
We can either talk about something that you have tried to bring up in the past, or we could talk about something that you could imagine you will want to bring up in the future.
Right.
Which do you think would be more helpful?
Let me think for a minute.
So now we're finally going to define a specific problem to work on. I don't want to just talk to her in generalities about how she can be less emotional or how she can get her message across better. I want to pick a very specific situation with her.
We could talk about something that's ongoing, I guess.
Oh, that's even better.
Yeah.
So tell me about that.
Well, occasionally Mike will talk about our future together, and he'll say that he wants us to get married or live together or any of those things. And then we'll talk about it, and it seems to be a good conversation. But then the next time that I bring it up or want to say something about it, it's like we never had that previous conversation. It's gone. And so it seems like it's almost like he's responding to some some sentimental feeling or some romantic feeling.
So here I'm just collecting some more data about the problem.
And when I want to talk about it and want to really pin him down, it's like it never happened.
What does he say?
He just says, well, yeah, we'll talk about that later. And so that's one thing. I also feel like I haven't really conveyed to him what some of my concerns are with. I feel like he'll talk about things that he wants to see happen and is completely ignoring what I'm saying. One of the big issues that we had in the past, I think it's not going to be an issue now just because of biology, is he would sometimes say that he wanted to have children, and he wanted us to have children. And he would, he's a very methodical, logical person, and he would sit there with this very long methodical list and go through it, and I would be responding very emotionally trying to
Right.
get him to see my point of view.
Right.
And I would feel like he just did not hear a word I was saying.
Yeah.
That he would just keep on with his list and just talking right over me while I was just screaming at him. And so I still feel like that these issues are unresolved. And I still sometimes wonder, like, does he still think that we're going to have a child? And if so, why does he think that? And and every once in a while he'll say something that indicates that he does, and I go, but again, when I try to pin him down, he just skitters away. So it feels like there's these kind of big, important issues out there
Yeah.
that couples need to figure out
Yeah.
that we haven't. And so I think that's, that's frustrating.
Can you wait till the next time you see him in person to have a conversation with him
Yeah.
about these things?
Yes, yeah.
And you think that would be better than on the phone?
I think so.
So I'm gently guiding her to commit to having an in-person conversation.
You really can't.
Just from experience, I know that these sensitive topics are so much better done in person than by email or over the phone or through Skype.
And when do you see him again?
In 2 weeks.
Oh, he's coming very soon.
Yeah.
Oh, okay. So
Yeah.
this may be apropos to that time.
Yeah.
So what would you like to say to him?
I would like to say,
So it may be that Chi-Chi already has a very good idea about what to say and will be able to say it in an effective way, but I don't really know. So I'm collecting the data by asking her what she would want to say. And as it turns out, I think if she does approach him in this way, he will probably be defensive. And when people are defensive, it is difficult for them to see the other person's point of view. So in a moment, I'm going to suggest another way of approaching Mike and see what she thinks about it.
we probably can't be together. And I actually have told him that. And he just got very upset and was like, well, that's an extreme reaction. But I think he thinks that he can win me over by using logic and,
Persistence.
Persistence, yes. And he just is not getting it.
Now, I wonder whether there might be another way to approach him. If you were to say something like, Mike, I have something to talk to you about that really makes me upset, but I'm going to try to talk about it in a way so that I don't get so upset. Is it all right is this an okay time for me?
So I want her to have a prelude to this discussion by giving him some control over whether they're going to discuss it now or not, and also to alert him in advance that she understands, she knows that he doesn't like it when she cries and that she's going to try to control that, but that she may not be completely successful at that.
We'll only have a few days. We'll have about a week.
A week together. So you might want to bring this up, fairly soon to the beginning.
Yeah.
So maybe you could set a time if he doesn't want to talk about it right then. And it might be a good idea to do this when you're out at Starbucks or someplace having coffee or something.
Right.
And then you might, the way that you presented it before is certainly a reasonable way to present it. Except that you come across as a little bit angry and critical of him. So just another way of approaching him might be to say, I'm really confused. Because it's obvious to me that you've wanted a kid, or you've had positive feelings about having a kid for a number of years, and I haven't wanted to. And I thought that I had made...
So I'm thinking to myself, if I were in Mike's shoes, what would someone say to me that would appeal to me, that would get to me, that I would understand? That is, how can Chi-Chi deliver this message in a different way, make it more likely that he'll respond well to her?
He would say, what are your reasons for that you think that you don't want to have a child? Or that you don't think you can have a child?
Mike, I'm a little confused because I feel like I've gone through all of the reasons before, and I feel like you think, gee, if I can't cheat you.
So I want to continue the role play and see how she thinks Mike will respond to my suggestions. That gives me the chance then to help her know how to respond back to him in an effective way.
And then what do you say to that?
What do you say? I don't know. He would probably say, he would probably say, well, let me hear all of the objections and I will provide a solution for each of those objections. That's his way.
Yeah.
If you say, you know, I don't want something, I don't like something,
Yeah.
you know, his way is to say, well, you know, give me all of your objections and I will come up with a solution for each one.
And out of role play, Chi Chi, do you feel like you've already done that?
Yes.
And there's just no way he's going to.
No.
And so then I think you have to say, Mike, just any amount of logic
Right.
isn't going to change my mind on this.
Right.
I'm really sorry. I mean, I
Yeah.
wish I could go along with you. I can
Right.
see that this is really important to you, and you know I like to make you happy, and I
Right.
wish I could do this for you.
What's going on in my mind right now is she seems to be responding well to this role play. She seems to find it helpful. I'm making a mental note that I need to save enough time later in the session to get some of these ideas down in writing. She's likely to forget most of what we talked about in the session, unless it's down in writing.
He would hear that and he would understand that to some level. I don't know what he would do after that. I don't know. Part of my frustration with it is that I think that he has been in long-term relationships in the past. He had 2 long-term relationships before me. My feeling is that people who want to have children do that, they know that, and they do that pretty early in their life. So why didn't that happen with those?
Well, I'm not sure I completely agree with Chi Chi that people know earlier in life whether or not they want to have kids, but I don't want to get distracted or sidetracked from the main issue we're going to talk about.
People who do want children know it early, and they plan their lives that way.
That may be, or for any reason, but in any case,
Yeah.
I'm not sure how relevant that is
Okay.
if this is something that's so strong inside of you.
Okay.
Now, are you fearful that he may want to break up with you?
I am.
And would you tell him that?
So how did I know to ask that? Boy, I'm constantly putting myself in the client's shoes and thinking, if I were this client and had this problem, you know, what would I be thinking? What would I be afraid could happen? What would get in the way of my being able to solve the problem?
It's a very big risk. I don't think he would,
But he might need to think about it.
but he might need to think about it.
So she says she doesn't think that he is going to break up with her. I think that she's going to be pretty anxious about that possibility
You never know.
until something actually happens. But I want to try to lessen the anxiety in her mind by helping her first make the decision about whether or not to even have the conversation. And secondly, if they have the conversation and he does break up with her, I want to help her see that she'll survive. So a lot of what we're doing in the next few minutes is going to be to help her evaluate her thinking
Yeah.
that she predicts she'll have if they do break up.
And I think he needs to know. I think he needs to know, because if it does mean that much to him, then he does need to,
Yeah.
you know, find someone that will do that
He should actually have a rent-a-child for a little while, I think.
before he makes that decision.
Now, so far, Chi-Chi's not had a whole lot of distorted thinking. If she were depressed, if she had an anxiety disorder, we would expect that her thinking would be much more distorted. So more what we've been doing so far is a little bit of problem solving, some role playing to teach skills of communication.
That's going to be really tough.
Yeah.
It's going to be really tough.
Are you in the same position in life as you were 15 years ago?
No, I think I'm in a much better position.
So now I ask her a series of questions to help her see that
Financially stable. I'm
this time if she were to break up, she's in a different place. She has a lot more resources. She has a lot more skills.
better.
And that perhaps she won't be at as much of a loss as she was 15 years ago. As she says, she's older and wiser now.
But
Are you afraid of that negative emotion you'll feel if it happens?
yeah, I think it's going to be pretty bad.
Do you have a picture in your mind of what it might look like if it's really bad?
Now, many people do have automatic thoughts, not only that are in a verbal form, but that are also in an imaginal form. So I'm asking her a few questions now to see whether she has an image of herself. I had an image of her. The relationship is broken up. I saw her in a kind of a dark room, crying, feeling really lonely, feeling kind of devastated. And when I have a picture in my mind, then I know to ask the client, what would that look like, or do you have a picture of that in your head? She doesn't seem to be aware of an image, so there may not be one at all. But in any case, because she doesn't identify one, we just move on.
It would be very tough.
When would it be the toughest?
When?
So again, instead of talking about generalities, it'll be very tough. I want to see if she can imagine a specific time, and then we'll look for the specific thoughts that will come up.
Go to work, pretend that everything's normal.
Yeah. And would there be anyone at work you could confide in?
There,
So again, I'm kind of indirectly showing her that she has resources. She can get support from people. She doesn't have to be alone in this.
at least,
But instead of just telling her that, I'm asking her questions so that she can come up to these realizations herself.
maybe work would be a good place to take my mind off it.
Distraction.
A
yeah.
distraction. It might be it might be good that way. I have I certainly have friends that I could, get to distract me, as it were.
And to give you some support.
Yes, emotional support.
really
Just,
important.
yeah.
So again, I want to point out that Chi-Chi is not depressed. I think she's having a normal reaction. I think almost anyone, particularly a woman in her circumstances who's had this long-standing relationship, would be very upset with a breakup. Now, having said that, there's still a lot of things I can help her with. But if she were depressed, I would expect that she'd have very many more negative thoughts, particularly about herself.
That would be the way that I would handle it.
Well, what do you think about that? Do you think that's true, that you'd never be in another relationship again?
So here's another automatic thought: I'll never be in another relationship again.
Just start over.
Yeah.
And now I'm going to ask her a series of questions to help her evaluate that idea.
Well, it wouldn't be worth it if you never found somebody.
Well,
Probably would be worth it if you did find somebody.
yeah. Well,
No, whenever I can, whenever it's appropriate, I'll use humor to try to lighten the mood a little bit.
a slim to little payoff.
Oh,
So,
why do you think the payoff would be slim?
I think it's hard to find a good relationship, and I think it takes a lot of work when you're single to find somebody good, and especially as you get older.
Well, I think she's probably right about that. Maybe not 100% right. And there's certainly things she could do to maximize the chance that she could meet somebody else.
I mean, getting more intimate, getting closer, and then getting hurt again.
Right.
Yeah. No,
Right.
of course you wouldn't want to.
Yeah.
But do you think, especially if you perhaps were seeing a therapist, that would make it easier for you to do
Yes,
that?
I think so.
Again, I'm trying to point out that she has resources.
Yeah, I would probably have to. I would probably have to have one lined up just in case. Just in
Not
case.
a bad idea.
Yeah.
And you'd have your cats.
Of course.
Your cats are important
Of
to you.
course, they're very, very important to me. And
You might have your writing. Who knows? Maybe you do some.
I might have all kinds of things that could be a good substitute.
How long do you think it would be before you kind of had your sense of equilibrium back?
Well, even in the past when I've had really bad breakups, I think I always spent
So again, my point here is to help her discover
a short time.
that she won't feel emotionally devastated forever, that there are a number of things that she can do to make it easier.
Passed pretty,
And she has a lot of internal and external resources to call on. That way she doesn't have to be so afraid of feeling devastated if the relationship breaks up.
Maybe you find a Mike-like person who either has kids or they're grown or doesn't want kids.
Right.
Whatever.
It's possible. Yes. Yeah. Or he could decide that,
He wants to stay.
Chi-Chi comes across to me as such an incredibly likable, nice, warm, friendly person that I think it's likely that she would be able to have another relationship with a man that
I've had
could be
very
very good.
judgment about men, always.
But I'm not sure she completely sees herself that way. If I didn't think she was capable of having a good relationship with someone, then I probably would have had a different line of
I don't see that repeating.
questioning with her. And one of the things we might have talked about was the kinds of things that she could work on with a therapist to make it more likely that she could have a lasting relationship in the future.
And he was completely different from anyone else I'd ever been with. And in fact, I remember saying that to a friend of mine, and she said, her response was, "I like him already."
Oh, nice. So she recognized how important that was. So something changed in you. You saw something different in him.
Yeah.
And apparently,
So Chi-Chi has a fear that she won't be able to discriminate kind of a good guy from a bad guy in the future.
are you afraid you'll just lose that judgment?
Well, I don't know.
So I'm going to ask her some more specifics about what Mike is like and what her other boyfriends were like to see whether it really would be so difficult for her to discriminate.
It sounds like to me that Mike is different from the other guys. And so in what ways is he different?
He's very, being in a relationship with him is very, it's very calm, it's soothing, it's, I mean, that sounds boring, but it's not.
No, I understand.
He's reliable, he's predictable in some
Yeah.
ways, he's serious, he's a very, he's very caring in a he's actively caring.
I'm writing all of these adjectives down, these descriptors down, so that I can read them back to her.
Whatever it is.
Are you thinking you would not pick this up about another guy?
I don't know.
You'd not be able to tell whether another guy was calm, soothing, reliable, predictable, actively caring?
I don't know. I never did before. All my past relationships tended to be pretty chaotic.
Yeah.
Guys that were kind of wild and cheated on me and were, you know, drank too much and couldn't hold down a job. You know, all those.
Are you giving yourself enough credit here, Chi-Chi? You'd think you wouldn't tell the difference between calm, soothing, reliable, predictable, and wild, cheating type drinks too much?
I think I would tell the.
I think you would tell the difference too.
Oftentimes, when you repeat back patient statements to them, they can see the illogic in it and sometimes laugh about it.
Now, do you have a safety net? I mean, someone you could bounce this guy off of?
Probably. Yeah. Oh yeah. Sure. Sure.
Like who?
Friends. You know.
Friends. Or if
yeah.
you're seeing a therapist.
Or a therapist. Yeah.
Yeah. So you wouldn't have to 100% rely on yourself.
Right.
No, my guess is you've probably developed this gut sense now.
Maybe. It took me a long time, though.
It did take you a long time. But sometimes
I only say say things to patients that I honestly believe.
Sometimes I think about Mike and I think, God,
But often, I know that patients oftentimes really don't see themselves through a clear lens. They just don't see their strengths. They don't see their positive attributes.
so many important things.
And I really do think that
Some of them down in writing.
she probably could make this good discrimination.
it's better.
Doesn't matter.
Okay.
Or we could both do it if you want.
It's so important that Chi-Chi be able to make use of the important things we talked about in this session. So I've given her the choice of whether she wants to write things down or whether she wants me to.
So we talked about having a discussion with Mike. And so do you want to write down something about what that discussion should
Yeah.
look like?
Yeah, that would help me. I think. Yeah. Yeah.
What should we say?
So I want Chi-Chi to put it in her own words. And if she does a good job of it, then I can copy down her words verbatim. If I think she's not completely on the mark, then I'm going to ask her, what do you think? I think that's close, but what would you think about if we phrased it this way? And see what she thought. I want to make sure that these notes are really accurate, helpful, pretty crystal clear.
Long, drawn out.
Clients don't usually know themselves what kind of notes are going to be helpful after therapy.
Right.
And so that's why, especially early in treatment, I tend to be a little bit more directive
I don't know if it
in
helps, but I'd use the word
writing things down or having them write things down. I want to make sure that they're really on target.
Because then it's not like I'm saying that I'm angry or I'm hurt or just confused.
And another thing we talked about was saying, I'm so sorry that we want two different things
Right.
here.
Right.
Now, writing things down does slow down the session. On the other hand, by discussing these important points aloud, it again emphasizes with the patient what's going to be important for her to remember. So it's useful within the context of the session itself as well as after the session is over.
This is
Right.
going to work.
Right.
I imagine if he keeps on insisting that you may have to go along with him and say, okay, I'm willing to do this one last time.
Right.
And then at the end, I have to tell you what my conclusion is.
Yeah. Yeah. Yeah.
So it had actually occurred to me previously when we had been doing the role play that he might not respond so well and he might insist on going back to his usual strategy of having her lay out the arguments and then trying to counter each one. And at the time I realized too that it would be good to prepare her for the possibility that she'd have to go through it one more time with him. But I didn't want to interrupt the flow at the moment, so I made a mental note and then figured later on when we were writing down notes as we are now that I could address it.
But that this is just not something that I can do.
Yeah,
If there were any way to do it, I would, but
yeah. Okay.
Now, if this had been a depressed patient, I probably would have stopped right now and asked her for the meaning of her thoughts. We probably would have uncovered some very negative ideas that she had about herself.
Like most men.
But she's not depressed, and I think she has a reasonable, although not as positive view as I have of her, but a reasonable view of herself. And I want to just continue on with the problem solving and
We're
okay.
in good company.
discussing what it is that she can do after the session.
Next thing we talked about is if he breaks up, if he
Right.
decides to break up with you. So if we break up, and what do you think would be important for you to remember?
Now, when I first started doing cognitive therapy, I wasn't nearly as good as I am today. And as I'm watching this now, I realize that I've been able to hold in mind a lot of the key points from the session. However, on the previous page, I'd been taking notes all along, and if I couldn't hold it all in mind, I would have just referred back to my notes. So I make sure that we capture the important things.
Remember it differently.
Well, usually it
but
kind of
that's-
comes and
Right.
goes, but most of us can't maintain emotional
No.
intensity for
Right.
a long period of time. We said that work could be a distraction.
Friends, therapy.
Yep. Friends, therapy. And we also talked if we
Now, interestingly, Chi-Chi does have a negative idea about experiencing emotion. When she walked into the session, I think she thought, I won't be able to discuss an important topic like having children with Mike because I'll get too upset.
say something like
And then we just did a little bit of problem solving about that.
about a new relationship.
And she was willing to do it. So I don't think she has an intense fear of negative emotion as some patients do.
About how your judgment is much different from how it used to be.
I hope so.
There were really two things that we talked about. One was how to approach Mike. We did role playing about that. And then the second thing that we really talked about was if Mike breaks up with me,
My father
I won't find anybody else.
was somewhat similar.
Although usually you don't want to compare our relationships
I know.
to dad's.
Yeah, I know. That sounds creepy, right? But
Again, the humor lightens up the session a little bit.
It's a natural thing that, not to gravitate
right,
toward initially.
right.
So judgment may be better and can get, I'm going to say, advice from friends,
Therapist.
therapists.
Yeah.
I think it's really important for therapists to have this upbeat, optimistic view. Patients come in and they think their problems are insoluble, there's nothing they can do, they frequently feel very helpless.
We started to talk about a lot.
But when we're cognitive therapists, we understand that
Yes.
many problems can be solved, not all. And sometimes we have to work on acceptance of some problems with patients and the problems that can't be solved. But oftentimes problems can, and what has gotten in the way is lack of problem-solving ability, or patient might have good problem-solving ability, but certain ideas might get in the way. Such as if I try to talk to my partner, I'll get so upset that
Whatever you think.
it will go terribly.
Is there?
I don't know,
if
do you
there's-
have your sense? What's your gut say about
I feel like this has been a very good. I think we've.
So I thought we were probably finished discussing this problem. Wasn't sure if Chi-Chi was finished with it, so that's why I asked her.
Work and apply some of the things that we talked about here to work.
Right.
Okay. So a typical situation is you're at work, and then what makes you have the thought, what if I lose my job?
If I feel like there's something coming up, something I have to have done, that I'm behind.
So here I'm just reviewing with her the cognitive model through this specific situation.
When I think I'm going to have it done.
So the situation is she's under pressure from her boss, and
I always
she's scrambling to meet a deadline. The automatic thought is, oh, what if I lose my job over this?
I've created
And then she feels quite anxious.
myself, and I feel like I'm in a panic state, and
So again, the first thing I'm doing is collecting more data to fill out the cognitive model and find out more about the problem.
unnecessary
We'd actually talked a little bit about this problem yesterday.
layoffs at work.
The major thing we had, in the previous session that morning,
Just kind of hanging
we had talked about her problem with procrastination and came up with some solutions in terms of being able to get herself to do more creative writing, to do some social activism, and so forth. And at that session, we had also talked about applying the same techniques to getting things done at work.
If you had the thought, well, he's a little anxious himself, but I've
a
always
she,
gotten,
but-
or she, I'm
Yeah,
sorry.
it's all right.
I've always gotten my projects done in
Right.
the past.
So now I'm really teaching Chi-Chi the cognitive model. If she has a certain set of thoughts, like what if I lose my job, she's going to feel anxious. If she has another set of jobs, such as, well, I'll probably get it done, or even if I mess up, I'll probably be able to keep my job, then as Chi-Chi acknowledges, her anxiety would be much less.
Are influenced by what we think, by our perception of the situation. And when we're anxious, sometimes our thinking is realistic, and sometimes it's not.
Okay.
So one of the questions, I'm going to teach you two sets of questions. One set of questions has to do with just looking for the validity of your thoughts. So what's the evidence that if you don't meet a deadline, that you would lose your job? Is there some evidence? Has your boss said things before?
So now I'm going to use Socratic questioning to help her evaluate the reasonableness, the validity of her automatic thoughts. And then next I'm going to teach her to decatastrophize her thoughts. And these are two key lines of questioning that we would use when someone is feeling anxious.
I have two bosses, and my
When we identify an important automatic thought to work on, and that is a thought that is currently distressing
she's an extremely
or leading to maladaptive behavior or pronounced physiological effect. When we identify a key automatic thought, we want to help the patient not only evaluate that thought, but also learn how to evaluate similar thoughts in the future. We might use any kind of line of questioning to help patients evaluate and respond to their thoughts. So I'm just picking out two particular questions that we tend to use in anxiety, but there are many questions we use. The first set of questions usually does have to do with looking for evidence that thoughts are accurate or not accurate. Second set of questions has to do with helping patients look for alternative explanations or other ways of viewing the situation. The third set of thoughts, as you'll hear in a moment, have to do with decatastrophizing the thoughts. The fourth set of questions has to do with looking at the consequences of thinking in a certain way. What's the effect of believing this automatic thought? What could be the effect of changing my thinking? Fifth question has to do with getting some distance from the automatic thought by thinking, what would I tell a specific friend or family member who was in this situation and had this thought? And then the last question is a problem-solving one.
and get it done properly.
So I have this problem, what should I do about it?
No.
So that's one series of questions that we could use with automatic thoughts, or we could use any line of questioning to help patients get a different viewpoint.
Use the skills we talked about this morning.
Or we
Get yourself
might help them respond to their automatic thoughts in a wholly different way, maybe by using some self-disclosure, maybe by giving an analogy or talking about a metaphor, certainly by doing behavioral experiments when patients are making negative predictions, is to go ahead and
screw up badly.
behave in an adaptive way that we've discussed and then see the outcome.
She wouldn't be happy about it. Is there any evidence on the other side that you could screw up and not get fired?
Um,
Now, I don't really know in advance whether the thought,
yeah,
if I screw up, I'll lose my job, is accurate or not. That's one reason why we don't try to persuade patients. We're not confrontational with patients. We're going through a process of collaborative empiricism where together we're trying to figure out
even though she
the validity and the utility of their thinking.
work on time, she's always like an
So I really do want to find out what evidence the patient has that the thought is true. Some automatic thoughts are true.
every time we have an evaluation, and she keeps saying, "Can you please,
Yeah.
please just get here?"
But she's never gotten
When patients' automatic thoughts are true, we usually do one
Might be a little.
of or two or three of the following.
to remember, I think,
One is sometimes we just need to solve the problem.
and anyone,
The second thing is, although a patient's automatic thought might be accurate,
unless
the
it's
conclusion that the patient draws might not be.
raising.
And then the third thing that we sometimes have to do is to help the patient accept the problematic situation,
Nobody knew. Well, that's true.
Okay.
if there's nothing they can do to change it,
Negative
and then help them build up their lives in other
that
ways.
is true. And is there any evidence on the other side that maybe it's not true?
Right.
Then the second set of questions are,
So now I've just summarized what we did, how we looked for the evidence.
so if the worst happened and you lost your job, how would you cope with that?
I would take all the practical steps of making sure that I got unemployment and
See another indication that Chi-Chi is not depressed. If she were depressed, she might really be at a loss. When I ask the question, what would you do if you did get fired? How would you cope with that?
You found other jobs.
so I know what to do.
Okay. So that's a known quantity too.
To the quantities, yeah.
So you'd be able to cope. You know the steps. that you
Yeah,
need to
this
take.
economy is a lot tougher.
It is. So
And
it
I'm
might take
older,
longer.
And
Yeah.
and I'm older, so I can't be
But-
quite
but-
that cavalier
But
about
you'd
it.
survive.
Somehow I
in
would.
the probably unlikely chance that,
Right.
that you got
Somehow I
fired.
would.
But so that's the worst, and usually our minds gravitate toward the worst.
Yeah.
What's the best that could happen in this situation?
I could use my set of steps that we worked out here and do such a great job that my boss would be amazed at how
Yes.
much better I was doing.
Either that, or that you'd get a new job that you liked even better.
That would,
That would
be,
be either one of those would be the best. And what do you think is the most realistic outcome?
probably the first one. I think getting another job would be,
I'm sorry, just the whole most realistic outcome if you're at work, you're behind and you're scrambling.
Oh.
What's the most realistic outcome? That you would get it done in time?
that I would get it done on time, and that I would be safe another day, I
You'd be
guess.
safe another day, or another year,
or another month, or whatever.
Yeah,
Yeah.
So
Yeah.
when you're feeling really anxious, you want to look for these negative.
So again, now I'm doing some psychoeducation, teaching her how to use these techniques herself. Cognitive therapy is a very empowering kind of treatment.
On the other side, that maybe it's not likely to come.
We really want to equip the patients with skills.
If it did come true, if the worst did happen, how would I cope?
Right.
But that's just the worst outcome. What's the best thing that could happen in this situation? And then what's the most realistic outcome? And I think if you practice this, you may need a little help with a therapist, or you may
Yeah.
be able to do it on your own, then I think you'll find that your anxiety starts to come down.
Right. Right.
And we use similar questions actually with Mike. What's the evidence that he would leave you or not leave you? What's the evidence that you would or wouldn't be able to find somebody else? If
Right.
the worst happened, how would you cope? What's the best and the most realistic?
So again, I just want to reinforce this learning.
Yeah, but yeah.
So, so these questions work for any
That's
sense
interesting.
of anxiety.
That's really
that you
interesting.
have.
It's yeah.
So what did you think about our second session together?
I thought it was really good. I mean,
So a standard part of cognitive therapy is asking for clients' feedback at the end of sessions. We want to really make sure that the patient feels as if the therapy is right for them, that we, the therapists, are attuned to them. And we want to find out, although I didn't ask it in this session because I won't see Chi-Chi again, but another standard question is there anything you'd like to do differently next session?
things seem smaller and much more manageable than it is.
That's exactly right. That's what we aim for.
I thought Chi-Chi just gave an excellent summary of
And
our two sessions together where
enormous
we took problems that were very, very big in her mind and
blocking and
we're able to really specify them and then come up with a specific plan for them.
really big deals. What's the big deal?
Well, they're
And-
big deals unless you have the tools for them.
Right.
Like the
yeah.
rubbing alcohol for the ink on
Right.
I was just giving her an analogy we had talked about in the first session. My ink had, from my pen had leaked, and I couldn't get it off with soap and water. That just wasn't the right tool, but once I used rubbing alcohol, then it came off. And it's an analogy I use a lot with patients, especially if they're feeling hopeless that anything can ever help. It may just be that they've not been taught the tools
Center of my life,
before.
that there are other important things going on, that
What do you feel like you have more going for you?
yeah,
In
that
a
that I'm
way.
not such a big loser.
No, of course not.
Oh, another automatic thought.
One of those automatic thoughts.
Right.
What's the evidence for that? A lot of evidence against that.
Right.
Chichi, I'm so glad we had the chance
I'm
to
so
talk.
glad also. Thank you so much. Thank you so much.